Welcome back to Houston Life. We'd like to think we know our pets best, but there is a hidden danger that they can't tell us about: dental pain. It's often misunderstood and overlooked, but veterinarians like Dr. Marshall Beggs are changing the game. As founder of Houston Pet Dental and Spring, Dr. Beggs uses advanced training, imaging, and skilled anesthetized cleanings to give cats and dogs a pain-free mouth and a better life. He joins us now with his dog Ruddy to explain why dental health for your pet could be life-saving. Doctor, welcome to the program.
Thank you for having me.
So I had to admit right off the bat that I am a pet mom of two small dogs, and they are notoriously known, small dogs, for having terrible oral health.
Why? It's that. My 15-year-old dog has better teeth than my 2-year-old Chihuahua. Why is that?
Good questions. One, it's a combination of genetics.
Okay.
Just like some kids need braces by the time they're 10, they've got multiple cavities. Also anatomy. Big dogs tend to have more root structure, more bone support. Little dogs, we've essentially crowded all of those teeth into one tinier space.
Gotcha.
And they don't brush twice a day.
No, as much as I love to say that I brush my Minnie's mouth twice a day, that's not happening.
Yes.
But I want to talk about Houston Pet Dental. Tell us a little bit about the business and what really got you into this.
Absolutely. So for years, it was recommended, get your dog's teeth cleaned. Sure, the owner would leave, and never saw it as a true emergency, so they would put it off. Eventually, year after year, until the pet's teeth were then falling out. And at that point in time, it was past cleaning teeth. It was more oral surgery.
Right.
So the cost of things, pets are living longer than they ever have. So it's more prudent now than ever to clean the teeth before we're actually having to take the teeth out. Much older pets, just like when you started having teeth, we started brushing them. So same with pets. We want to start early as opposed to letting that pain develop and the advanced periodontal disease develop.
Gosh, because that's the thing when you think about it. Like, imagine having toothache and they can't say, and it could go on for years.
And it does. It does.
There's some signs that you can tell your dog's in pain, though, isn't
Absolutely. There's a sad saying, but the number one sign of oral disease is no sign. The reality is, we used to assume if a pet is eating that they are entirely comfortable, there's no problem, they eat, but what we've learned is, their options are either one, don't eat and starve to death, not great, or plan B, just get tough. So these dogs will develop signs where they become picky eaters, or they prefer only canned food,
soft food, yes,
or they may miss meals here and there, and owners, essentially look at them and think, well, he's old, he just doesn't have an appetite. But we have countless pets that once you remove pain, whether they're a year old, retained teeth, think of wisdom teeth like, or if they're really old and we take several teeth out, they eat better afterwards because the pain's gone.
I know that we have a couple of pictures of what gingivitis in pets' mouths look like, so this would help some of our viewers acknowledge and to see what they're actually looking for.
Absolutely.
Raise your hand if you're, I don't want to say guilty, but I've had a couple of pets where it's not been this bad, but when your pet's mouth is not looking tip-top, right?
Correct. Yeah, and most people don't look, and I always encourage people, you don't need me to appreciate abnormal. So if you think your pet is having bad breath, or honestly, just have a look once a week. Because if they have any oral tumors, broken teeth, things of that nature, you'll never know until it's advanced. So just have a look.
Okay. Look. Ooh, that's advanced.
To look at for sure.
Ooh,
This mouth is pretty rowdy.
Yeah.
And I always like to say teeth didn't get bad overnight.
Right.
So that's a pet where on the left side you're going to appreciate normal, and on the right that is complete loss of the supportive bone and exposure of nerves.
Are we looking at good? Is there a good?
Good and a bad?
Yeah. So the left is going to be good and normal. Those are protected tooth roots with protected anatomy. On the right, those teeth are essentially floating in a sea of bacteria and inflammation.
Okay, so tell me the truth behind this. I have heard a greenie a day keeps the doctor away, but some people are like, no, that's not going to help everybody. You're just giving your dog a treat. So the greenie is like the stick treat that's supposed to help kind of remove plaque and a little bit of gingivitis in theory?
Correct. So that's a really big misnomer. People want to do the right thing, but people, let's face it, we're not brushing our dog's teeth twice a day, which is fair. So the next best thing is where people will come in with the greenies, the additives, the chews, the water, whatever.
The rawhides.
Yes. Yeah. So those all have their purpose, but nothing replaces brushing.
So brushing is, you're actually getting in there. If you brush your dog's teeth twice a day, you'd be doing them a big favor.
Absolutely. And I tell folks all the time, if you can brush your dog's teeth twice a day, you're a rock star, and you're not going to see me that much.
Right.
So.
Okay, let's talk a little bit about the importance, though, of anesthetized cleaning and imaging, because the imaging really helps you see what's going on underneath the surface.
Absolutely. The imaging, I would say, is probably more important than the cleaning. I'm old enough to appreciate a long time ago, we would simply clean teeth and send the pet home. And what we were doing, just by a lack of awareness, was we were sending home painful teeth. So most of what we find, the pathology is in the x-rays. So you can, for example, you can clean Ruddy's teeth, but unless you x-ray, you're not going to see that infected granuloma. That's painful. So you can give yourself a pat on the back and say the teeth look great, the mouth smells great, but your dog's still in pain and you have no idea. So you've really done them a disservice.
Okay, Houston Pet Dental, let's talk about your price points. That's really kind of what sets you apart from everybody else in the market right now.
Absolutely, yeah. We have one fee, whether it's a big dog, little dog, old dog, doesn't matter. The one fee is $4.99, and that includes complimentary consultation. So I don't even charge people to come in for me to look at their dog's mouth, and then I personally sit down with every client and walk through what their dog has, what that looks like in reality, what I think we're going to need to do. That way they at least know, and there's no surprises, because for years people were afraid of anesthesia. They were afraid of the cost. They just didn't know, and when they're looking at their pet eating, they go, he's fine.
And you never know how many you're like going to call. Oh, it's a couple of teeth. Oh, it's 5 teeth. And it can make a big difference.
Exactly.
Oh my gosh.
Well, we may have to FaceTime you with my dog Minnie so she can see Ruddy and she can see you on camera and take a look.
I just feel like I want to hug
I feel like Ruddy's teeth are beautiful. Thank you for all the great information. Dr. Marshall Beggs, Houston Pet Dental. It's really, really great to know, especially when you can help your dog tell everybody your problems without telling them your problems, right?
Absolutely.
And Dr. Beggs' team is ready to help your pet's pearly whites with a complimentary consultation at their office in Spring. To schedule, you can call them at 832-702-7599 or visit their website, HoustonPetDentals.com. That is dentals with an S. Ruddy, you're so good. You did so good. Thank you so much, Doctor.
His breath smells good. His breath smells good. You know what?